Welcome back, Dr. Harpreet Lote joining us from Sona MD. Once again, Happy New Year to you.
Happy New Year to you too,
yes,
Susan.
Yes, one of my biggest complaints, honestly, at this time of the year is the dry weather. How dry the air is. It affects all of us. I suffer from eczema. I break out with these crazy, not hives, but blemishes all over my hands. Itchy, itchy, itchy.
Right.
This is not uncommon for many people.
No, it's not. No, it's not. And so, you know, just I wanted to sort of get together with you and talk a little bit about ways to manage that, but still stay on our recommended sort of treatment protocol for skincare. So, you know, we've talked before about the 4 things that we like to have all of our patients on in terms of maintaining healthy skin. Some of those things can actually be a little bit drying. So the question always comes up, how do you manage that but stay on your treatments?
Yes.
So we like to have people on retinols and vitamin C or antioxidant creams. Those can be a little stingy, a little drying. The challenge is if you go off of your retinol creams, it will take a while to reacclimatize your skin to it again. So we don't want you to go off. So how do you manage that?
Right.
So with respect to that, I usually tell people to add on a very good quality moisturizer. And you don't have to go to something that's extremely expensive. We'd rather that you spend your money on your skincare that has active ingredients in it, like your retinols, like your vitamin C, like your growth factors. When it comes to adding on moisturizer, I wanted to share with you some of you know, one of the brands that I think is quite good and available without a prescription and over the counter.
Okay, so these are some of these.
Yes, so jumping to the second, the white,
these two?
These two here.
Okay.
One of my favorite brands that you can pick up at any of the drugstores is actually Aven. And they have a moisturizing product called Cicaphate, which is extremely well tolerated by people who have things like eczema and sensitive skin. And it's a heavier weight sort of moisturizer. Okay. And you can actually put the moisturizer, if you're extremely sensitive, extremely dry, you can put the moisturizer on first before you put your retinol on.
That's good. That will help.
Yes.
Yes.
And if you've just got some mild to moderate dryness, go ahead and put your retinol on at night and put the moisturizer on top. Okay. If you feel like the Cicaphate is sort of too heavy a product, you can move on to their newer product called Epitheliate, and this is a lighter moisturizer, and so and you can use it similarly. Okay, so that's if you're not suffering from extremely dry. That's right. Skin. That's right. Okay, good to know. And you would continue on with your recommendations, and don't try not to go off of them. Is the big takeaway there. Yeah. And then what about these? These is my favorite product that everybody should be on, and I go on and on about sunscreen all the time. Yes. Every day. And we continue to encourage people to use their sunscreens in the winter. You know, when you're out hiking or snowshoeing, you're going to have the reflected sun rays, and that can actually be augmented because of the reflection. People also go away this time of year, and you know, it's important to take a good quality sunscreen with you. So that continues to be an important thing. One of the things that I like to add in this time of year to my routine is like a thermal water or a spray, and you can get these in smaller containers that you could throw in your purse, and you can just spritz those. And if you travel, it's perfect for the airplane because our skin gets so dehydrated on the plane. And so when do you recommend spraying? Do you do this before bed, when you wake up? Like when do you spray this? It's just like it's just water. So most of it's just mineral water. So you can use it as needed right on top of the makeup. And I find that with a lot of the mineral makeups too, when you apply this on top, it gives a really nice sort of dewy finish to the makeup as well, and actually helps the makeup blend nicely into the skin instead of sitting on top. Yeah. And then finally, what is this one all about? That's a great product. It's a Zeo makeup primer with as a sunscreen. So what I like about it is it's dual function. So if you're the type of person that wears makeup every day, you can put that on underneath it will allow your makeup to go on nicely. In the wintertime, a lot of people complain about dry skin causing textural changes. So when they put the makeup on, it sort of sits on top.
Yes.
So along with regular exfoliation, using a good quality primer is a great thing.
Not displayed here to talk about specifically, but beyond this, if you're looking at getting some more intensive treatments done on your face, is winter a better time because you're not in direct sun, in direct heat? I understand it's not good to be in direct sunlight after you've had treatments.
Yeah, winter's a perfect time for more aggressive treatments, specifically the laser treatments that we do, the resurfacing lasers. It's a perfect time.
Okay.
Those lasers actually will create little little holes in the skin and then allow appropriate wound healing, improve the amount of collagen in your skin, help with pigmentation irregularities like sunspots, as well as redness in the skin. And the healing time with the treatments that we do is about 10 days, but you get fantastic results.
Yeah.
It's just important to stay out of the sun, so this is perfect timing.
Good to know.
Yeah.
And then what is this all about? It's like a pillow.
Well, the other thing that's really important for our skin health is sleep, and we don't talk enough about it. You know, sleep is important for so many different functions in our body, and we're starting to learn just how important it is, but specifically for your skin, it will allow it to function better. The challenge when it comes to aesthetics with sleep is oftentimes when some of us have the habit of sleeping on our sides, like I do, and or on our faces, and that's not so great either post-treatment or for our face in general.
Sure.
So this pillow is fantastic in that it's got both neck support, and if you tend to sleep on your side, it will actually sort of create a little push on your side so the majority of your face is off of the pillow, which is fantastic.
Right.
It also has some pillowcases, silk pillowcases that you can get that it's great for your hair to decrease the amount of static, which is always an issue for people this time of year as well.
Static is terrible at this time of the year, isn't it? Yeah.
And there's also copper-infused pillowcases available for it that have some antimicrobial function, so it helps with acne and rosacea and things like that.
That's something you would never even think about, or a lot of people wouldn't think might be helping. So.
No, and if you're prone to acne, having pressure is not a good thing either, because that does create pressure-induced acne for people. So that's a consideration there as well.
Awesome.
Yeah.
We're out of time. I really appreciate you being here. A lot of great suggestions. Thank you. If you have any questions about skincare and, you know, making the most of the winter months, if you're looking at getting a treatment done, you can certainly look them up online or give them a call, but it's sonamd.ca. Thank you so much.
Thank you.
Yes, we'll be back in 2 minutes. Stay with us.